Hello and welcome to this Global Health Initiatives Replenishment 101 webinar. Welcome, my name is Ansley Moore, and I'm the Senior Manager for Advocacy and Engagement at Global Health Council, and I'll be moderating today's discussion. For those of you who may not be as familiar with Global Health Council and our work, GHC is the leading membership organization devoted to advancing global health priorities by uniting advocates, implementers, policymakers, and other stakeholders. Using the power of our community's collective voice, we work across disease areas to drive sustainable funding and equitable policies that improve global health and well-being for all. As you likely know, several multilateral global health replenishment campaigns are set to occur this year and next year, including for Gavi, the Pandemic Fund, the WHO's investment round, and the Global Fund, just to name a few. These campaigns are taking place in an environment that includes both constrained budgets and national elections in many donor and partner countries. With many of these campaigns recently kicking off, we think this is the perfect time for a conversation among civil society to discuss how we can best support these efforts and help mobilize funding for global health priorities. With that said, allow me to introduce our excellent speakers for today's webinar. Janine Madan-Keller is Deputy Director of the Global Health Policy Program and a Policy Fellow at the Center for Global Development, where she leads policy-oriented research focused on economics of global health challenges. Since joining CGD in 2015, she has published on a wide range of topics, including global health procurement, the use of evaluation and programming and policy, results-based financing, sexual and reproductive health, and financing for pandemic preparedness and response. Janine holds an MS in public health, nutrition, and food security from Tufts University and a BA with honors in political science and French from Vassar College. Rosemary Mburu is Executive Director of Wacky Health, an Africa regional advocacy organization championing the end of life-threatening epidemics and improved health outcomes for all in Africa. Rosemary is a public health and policy advocacy expert with nearly 2 decades of experience working with civil society in Africa. Rosemary has served in various capacities within the global health architecture, including on the UHC 2030 Steering Committee as a CSO representative, the Unity Communities Advisory Group, Gavi CSO Steering Committee, and the Vaccine Advocacy Resource Group. Rosemary holds a master's in public health from Ohio University, a master's in business administration from Frostburg State University, Maryland, and a bachelor of education from Kenyatta University in Kenya. And finally, last but not least, Jenny Ottenhoff is the Senior Policy Director for Global Health at the One Campaign. Jenny brings over 15 years of experience in policy analysis, campaigning, and strategic communication with previous roles at the Department of State, including in the Office of the Global AIDS Coordinator, the Center for Global Development. Jenny holds a BA from North Carolina State University and a master's in public health from George Washington University. Our speakers will set the stage, and there will be an opportunity for questions later on in the meeting. Before we officially get started, I'd just like to remind you of a few housekeeping items. Please remain on mute when you're not speaking. As I mentioned, there will be time for questions later in the meeting, and during that portion of the meeting, please feel free to use the raise your hand function and wait to be called on, or put your question in the chat box. And also, just to note, I'm sure you recognize when you came in that this meeting is being recorded. Thank you, and with that, I'll hand it over to Janine.
Great. Thank you so much, Ansley. Thank you so much to the Global Health Council for organizing this important discussion. And of course, thanks to all of you for taking the time out of your day to join us here today. So as Ansley mentioned, I'm going to start and kick us off with a big picture overview and really help set the stage for our conversation. So let's start with the basics. What is a replenishment? So essentially, every couple of years, various multilateral development funds, international initiatives, and institutions seek to raise additional resources from their donors via fundraising drives or campaigns. And typically how this plays out is an institution will announce an amount of money that they're seeking to raise, and that will essentially kick off a fundraising campaign that will last over several months typically, and most commonly it kind of ends in some sort of pledging event. So this process is, every institution is a little different, but generally speaking, this is kind of what we're referring to when we use the term replenishment. And these funds, of course, include many of the important players in the global health ecosystem that you all are very familiar with, but it also includes other MDB funds and thematic funds that are focused on other sectors, whether that's climate or education. And most of these funds, I would say, tend to run these fundraising cycles on about 3 to 5 year period. So based on basic math, the timing of these fundraising cycles tend to overlap or coincide every few years. So just to give you an example, Gavi is on a 5-year cycle, so they essentially kick off this process every 5 years. They just kicked off this process in Paris last week, in fact. And then the Global Fund is on a 3-year cycle, so slightly different than Gavi, which I'm just using 2 examples that I imagine you all are very familiar with. So the current outlook is that we're in a moment where we are seeing many of these replenishment campaigns in 2024 and into 2025 sort of overlap in time. And this slide here is just, again, a non-exhaustive compilation of some of these replenishment campaigns that we anticipate taking place over the next year or 18 months. So we have several of them just in the global health ecosystem. So maybe I'll just highlight a couple of examples. And I tried to star the global health ones. So there's the blue stars on this timeline. So I just mentioned Gavi just kicked off their replenishment campaign last week. They're seeking to raise $9 billion for the period 2026 to 2030. For the first time ever, the WHO is going to host what they're calling an investment round, where they're going to seek to raise a little bit over $7 billion. The pandemic fund is going to be raising about $2 billion, per my understanding, sometime later this year. And then also the World Bank's IDA, the International Development Association, which is the arm of the World Bank that focuses on low and lower middle income countries, is going to be seeking what their new president, Ajay Banga, calls the largest replenishment of all time. And they're going to be seeking about $28 to $30 billion. So this is, of course, a lot of money and a lot of replenishment campaigns, even if we don't know exact timing for all of them, starting to happen in a pretty compressed period of time. And I should mention that this is not necessarily the first time that we are witnessing an overlapping like this, but I would argue that there are a series of broader economic and political factors that are making this upcoming cycle of fundraising particularly challenging. So I'm just going to highlight 3 of these factors that I think are creating some particular and unique challenges. So the first one that you are all probably familiar with is just the fact that foreign aid budgets in several of the top donor countries are increasingly constrained. Many of the same donors essentially are being asked to contribute to multiple replenishments. And this slide here essentially tells us that for the most part, looking across funds, so these are funds in the global health space, but also including examples beyond the global health space. And it shows that for the most part, there are about 10 bilateral or government donors that really dominate as contributors to a majority of the funds. And what you can see here in this chart is that the teal or the blue lines are showing the contributions that are coming from the top 10 government donors. And for the most part, on average, they tend to provide as much as 85% of the total resources for each of the funds. And what we're seeing in the current climate and landscape is that donors are not necessarily allocating additional funding to things like support for the war in Ukraine. In fact, there's some risk that they might be shifting resources away from other development priorities. And what some of the latest bilateral aid figures or numbers that are collected by the OECD show is that in some cases, many of these top government donors are also starting to count the cost of hosting refugees within their own border as aid. So a lot of these factors are creating additional pressures for this upcoming cycle of fundraising. We've also seen in the last few years the creation of new funds. So we all know about the pandemic fund that was launched into 2022 in the aftermath of the launch of the COVID pandemic. But there are also new funds. We saw the creation of the Loss and Damage Fund in 2023, which is aimed to help compensate countries for climate-related shocks. And as I mentioned, for the first time ever, the WHO is also in a slightly different financing approach, going to be seeking to raise about $7 billion from governments and the private sector through what they're calling their first ever investment round. Next slide. And as I mentioned, a lot of these funds, oh, can you go one back, please? Yeah, a lot of these funds are essentially relying, so here you see the top 10 donors that a lot of these funds are relying on. These are the top 10 government donors. So I'll just give you one example. For example, the pandemic fund, for example, its largest contributors are the EU, the US, and Germany. And of course, as you all know, these are also the top funders across global health. So this is just an example and it's non-exhaustive, but it provides you a little bit of insight on some of the challenges that we're having to grapple with. Next slide. The other key challenge is that we have upcoming elections in many of the top donor countries, and this introduces another element of political uncertainty. So you've all heard that 2024 is being hailed as the biggest election year in history. 6 of these 10 top bilateral donors that I showed you on the slide before have upcoming elections, either later this year or next year. You're obviously familiar with the fact that the UK is in their election period with the general election happening on July 4th. Of course, we're entering the election period in the US, but there's also going to be upcoming elections next year, I believe, in Norway, Japan, and Canada, which are all key donor countries. And then we're also seeing, in some cases, in European countries like Germany and Switzerland, that they're facing different kinds of budget crises, which could also result in cuts to their overseas development assistance. So this is just a big picture overview. Just wanted to highlight that this is certainly not the first time that we're seeing what my colleagues and I have called a replenishment traffic jam. But this is a particularly unique set of challenges that could have really important implications for the future of global health funding. So I'll leave you with with that overarching view, and going to pass back over to Ansley. Thank you so much.
Thank you so much, Janine. I saw a few people in the chat and what an excellent overview that was. So thank you for that. And now I will pass it off to Jenny to talk about the context on these different global health replenishments. Thank you.
Thank you, Janine and Ansley. All right. So real quick reframe. We have a replenishment traffic jam. Traffic jams are bad. We don't like them. This isn't bad. Frankly, these investments should be made by every government and every country every year without it giving a second thought. These investments should come alongside, not behind, defense and infrastructure, et cetera, without debate. Of course, that's not the world we live in. I'm not suggesting it is. It is the world we're fighting for. But I just wanted to say that because the multitude of replenishments that we're facing and that we're all focused on feels really overwhelming. It's a lot. It is a lot of money that we're asking for. It's a lot of political will that we're asking for in a moment when... Excuse me? Oh, in a moment when asking anything of our political systems feels really, really hard. So I just wanted to say that up front, it's a good reminder that this should be a no-brainer. It's an investment in human capital, in people, in their potential, in their productivity. And we need to take this opportunity with all of these replenishments lined up to remind decision makers of this over and over and over again. So I'm not trying to belittle the challenge. It is a challenge. I have nightmares about it sometimes, but I do think that it's important for us to remember, this is investments that are required across the board for all these institutions to get to where we want to go with health globally. So now that I got that out of the way, I want to spend a couple of minutes just discussing, what does this all mean? What's at stake? What are we watching for that's going to impact the outcomes of these replenishments? So first of all, there are a few kind of differences and similarities of these replenishments that we're navigating as we launch campaigns. First of all, the time frame for funding. Janine hit on this. All replenishments are multi-year, but they differ in the length that they're asking for funding for. So for example, the Global Fund has a replenishment every 3 years. Gavi has a replenishment every 5 years. The Pandemic Fund is relatively new. They've done these kind of pseudo replenishments, I guess, for the last 2 years. WHO's investment round is really the first time for an investment round like this, but we don't know if it'll be the last. So different years. This matters because really when there's a replenishment, a lot of people, a lot of advocates are going to policymakers and talking about these institutions. So the more frequently that there's replenishments, the more often that policymakers are reminded of them and asked to kind of commit money or political will to them. So it's been a while since we talked to policymakers about Gavi outside of regular budget cycles. We're going to have to do a bit more of a reminding. Politicians in different countries have changed quite a bit in 5 years. The political context has changed. So depending on how many years are between the funding cycles, there's kind of a different approach we have to take to how much we can assume policymakers know about these institutions and about these replenishments. Second, to state the obvious, they fund different things. Gavi's vaccines, preventable diseases among children, Global Fund, AIDS, TB, malaria, the Pandemic Fund, systems, pandemic prevention, IDA. It's a concessional funding window for a whole suite of things that the governments really get to decide what they want to put conditional funding to. We're pushing for them to put it towards health. So we need to lean into the differences of this and how they complement each other. So let's take the malaria vaccine, for example. Gavi, this is completely illustrative, by the way, but Gavi might be supporting the supply chain, purchasing malaria vaccines. Global Fund might be supporting service delivery in country. This is different ways that these institutions come around similar interventions. And, the Pandemic Fund might be funding surveillance in some countries for different elements of health system surveillance. So they each play a role to play. They are not kind of these investments aren't happening in a vacuum. They're all kind of puzzle pieces that complement government funding to complete the picture of what we need for good health for people. So they're funding different things, but they complement each other. Finally, each replenishment has a different host and a different form for funding. They will differ in size and scale, but there is all kind of, there's usually a kind of a culminating moment. Some have big standalone moments, others tack them on to other moments. For example, the World Health Organization is dovetailing with the G20 in Brazil. The Pandemic Fund might be also, I actually don't know the latest there. We're waiting to hear who's going to host for Gavi. We don't know who's going to host for Global Fund yet, but we expect Gavi to land at the end of this year. So a lot of question marks there, but it matters because the host is essentially a political champion. It's a government that's saying, we're committed to keeping this replenishment and this institution on our political agenda. We are going to use our political capital to get it done. And we've seen good hosts really can make the difference between a successful replenishment and a less successful replenishment. One example that comes to mind is the Global Fund replenishment in 2018. President Macron the day of the replenishment conference, the final day when a lot of leaders came together in Lyon, France, he was on the phone calling policymakers in other countries, getting them to up their pledge so that we got to the number. So a good host really is ready to pick up the phone, to prioritize this in bilateral meetings, and to make sure that the replenishment is a success. So hosts matter. We don't know kind of the hosting situation for most of the replenishments right now, and not all of them have a host. IDA, for example, isn't really hosted in the same way as a Gavi or a Global Fund, but having those political champions that will make this a priority and bring others along has a huge impact on the outcome. Okay, so what is at stake if the goals are not met? I'm going to touch on two different things. There's a human toll. This kind of goes without saying, but each of these institutions will do less with less money. Pretty simple math there, but what this means in practice, and it's good to remind policymakers, is that fewer people will access health services, fewer lives will be saved. One concrete example of this is Gavi, who released their case for investment last week. They will, if they're fully funded, they will vaccinate another 50 million people in the next 5 years. If they get less money, fewer children will be vaccinated, or they're going to have to move money around and something else won't happen elsewhere. This is not rocket science, but it's, we know that a child born in a Gavi supported country is 70% less likely to die from a vaccine preventable disease before their 5th birthday. Why would we want to do less of that? There is a human toll if these funding goals are not met. And that is really why we're trying to mobilize this funding. This year in particular, I think that there's also kind of a political toll. Global health has received pretty steadfast support for the last 2 decades. It's a legacy of bipartisan support globally that we're really proud of, and all of us on this call have worked really hard for. If these replenishment goals fall short of their target, it sends the signal that the world is retreating from global health, that health is no longer a global priority, or it's slipping from the agenda, that it's no longer the investment that governments are as united around. I don't want to make it complete doomsday scenario, but it does start to erode that kind of steadfast support that we've seen for years and years. And that's not the kind of signal we want to be sending both to countries that partner with these institutions, but it also kind of codifies a general retreat from multilateralism that we're seeing across the board. Honestly, global health multilateral should be an easy decision for governments to invest in. They're less political than others for the most part. I know that they get political, but they're less political than other multilateral organizations. They should be pretty non-controversial. So if we see governments retreating from these, it kind of codifies this general retreat from multilateralism. All right, so finally, I'm going to just make a few comments on scenario planning. What are we watching for? What's going to have an impact? I certainly can't say what the scenarios are going to look like. We hope we get full funding everywhere. We might not. The way that the timing of these lineup could impact funding. Gavi and World Health Organization are kind of first out of the gate. IDA's ongoing as well, I should say. Global Fund is in 2025. They're kind of at the end. Will that impact it? We don't know. But Janine mentioned the politics. Politics are going to have a huge impact, more of an impact than they have in the past. And I've been working on replenishments for over 10 years now. Politics will matter a lot this year. There are a number of elections in the next 12 months. This creates just uncertainty. Most governments cannot or will not make a pledge within a few months of an election, or during kind of that lame duck period after an election and before a new administration takes shape. So we're watching the UK with regards to that. We're watching France. We're watching the US, obviously. I'll come back to that. Elections aside, we're watching Kenya right now. I mean, tax reforms, the protests, the destabilization. President Ruto has been a champion for IDA and the multilateral reforms. We need more of that and more concessional financing to combat the debt crisis that's ongoing and the destabilization we're seeing. So the politics are going to matter. I don't know what's going to come out of this, but we're watching all of these really closely. I have to say as well that all eyes are on the US right now, at least until November. I feel slightly arrogant saying that as an American, but it's not with arrogance. The US plays such an outsized role in global health funding. The outcome of the US election, and especially this election, will have an impact on the future of global health. That is not a partisan statement. That is an informed prediction. We've seen from Project 2025 and other policy documents put out by institutions close to the Trump campaign that a second Trump administration will probably retreat from multilaterals. And there's been explicit mentions of this when it comes to World Health Organization. Also, if the Mexico City policy is expanded, it could be applied to multilaterals like the Global Fund and Gavi, which could make it difficult for these institutions to accept and prorate US funding. Tons of uncertainty there, but certainly something to watch and something we've never really dealt with to that level when it comes to elections in the US. I don't want to be alarmist. Global health still benefits from strong bipartisan support in Congress, and we don't know what will happen with this election. But I do think that up until November 5th, that uncertainty is something that everybody is watching. Other governments are watching, and we'll kind of see what happens. And either way, we'll be out there making the case for whichever government comes in. All right, finally, I'm going to end on a bit of a high note. Last week, the launch of the Gavi investment case took place in Paris. The U.S. made a 5-year pledge to Gavi that was a 20% increase over their last replenishment. This is at a time when we thought increases were, I don't want to say impossible, but I've definitely been a little bit of a cynic. Like, whoo, this is going to be hard to get any more money out of the system. And the U.S. was one of the first to come out of the gate with an increase. France pledged to at least maintain. We're going to push for an increase there. Spain came out, others did. I just want to say that I don't want to overstate the importance of that, but I just want to say it's a refreshing reminder that we should not lower our own ambition as we step into this big replenishment traffic jam or glut of replenishments. And we should just make the most of this opportunity. I'm going to pass it back to you, Ansley.
Thank you so much, Jenny, and thank you so much for ending on a high note as well. I think that's really appreciated during this time and this conversation especially. And with that, I will hand over to our last speaker, Rosemary Nguru. Thank you.
Yeah, so thank you so much. Good morning, good afternoon, colleagues. I hope you can hear me very well. Just in terms of civil society engagement and civil society role, I just want to first of all acknowledge, just to acknowledge and appreciate what colleagues have mentioned in terms of the fact that this is pretty much perhaps going to be one of the most difficult replenishments we have had in the last couple of years or in the last decade. And we have also seen how global health has fallen off as a top priority for many development partners or many countries. But I think for me, my first point around what civil society can do is first of all to shape the narrative in the sense that we cannot be the constituency that gives donors the reason to be less ambitious about these replenishments. And so we know all the reasons that can lead to a decline in ambition. So the context of war, the context of climate, the context of so many things where things have been prioritized and where maybe governments want to see funding go. And so I think one of our biggest roles is to shape the narrative in saying that these global health institutions have a mandate, and the mandate is an unfinished business. And then really make the case of, and Jenny, you've talked to it a lot in terms of what it means in terms of impact. So that's the first thing I wanted to say, that as civil society, we need to be the constituency that refuses to accept that there isn't enough funding for the global health issues that are being funded by the different global health institutions. Because when the world wants money, the world finds the money for whatever cause. And so money can be found, I think, in my view, for the global health priorities that are being supported through the investments into these global health institutions. And the other thing is to say that each global health institution has its mandate, and at a country level, because I'm speaking from Nairobi, Kenya, from a country point of view, it trickles down to a person. It trickles down to what we are talking about, a people-centered. So whether it's an HIV treatment, TB, malaria, reproductive health, routine immunization, is really going to a household. And so thinking about it from a perspective of people, people-centered investments as opposed to really emphasizing the competitive nature of the traffic that we are talking about. But looking at the synergies, I think that the funders right now, or the donors, are very keen to see the synergies across the global health institutions. So I think from a civil society point of view, being able to pinpoint areas where the synergies exist is also going to be very useful for us in this particular replenishment. And we know that there are certain global health institutions where the synergies are more nuanced, and where donors are seeking to see more synergies between some of the global health institutions. So I think for us, it's also mapping out where are those entry points where demonstrating synergies is going to help us win, as civil society and as stakeholders within the global health space. I think the other thing to say is that from a civil society point of view, then our advocacy is about increase in ambition and making sure that we can keep global health top on the agenda, even as it continues to fall off the radar. Now, I think from an implementing country point of view, it's very important that as civil society, we can bring the evidence of the impact of the global health investments in our countries. If we can demonstrate the impact of the Global Fund, of Gavi, the GFF, the different global health institutions, and we saw the roadmap, there are many of these global health institutions. I don't want to flag some and not others, but across the board, how can we be better at bringing forward the evidence of the impact of the global health institutions in our countries and in people's lives? And the other thing we can do is strengthening our collaborations across civil society. So one of the things I've seen working well is where civil society in implementing countries partner with civil society in donor countries. So basically engaging both sides, where you have civil society in implementing countries working on the demand side. I think it's important to continue to get, like the African leadership, for example, if I may talk about our region, to speak in support of the global health institutions, like being able to bring to the table the evidence of the impact and having the African leadership speak about that. So the demand side is very important. In our experience, one of the things we have seen is where some donors actually want to say and to see, well, we are contributing to this particular global health institution, but what are governments of implementing countries doing for themselves in this area? And so being able to, number one, speak in support of the global health institution's impact in our countries, but also be able to say, as countries, what are we doing for our in terms of our own domestic investments? And the other thing as civil society is to build allies. I think that allies with members of parliament is one of the things that has worked well in my experience. Having members of parliament champion the cause and contribute to the narrative of the impact and the evidence of why the global health investments are important. Building champions with heads of states in implementing countries, I think is very important. If it's a bad time to use the example of my president right now. So I think if a head of state in a country in Africa can pick up the phone and call a head of state in a decision maker in a donor country and have that conversation, I think based on the relationship of the two countries, I think that's really important in terms of building champions among heads of state or the highest level of decision makers in implementing countries. And the other thing I wanted to talk about is accountability, that as civil society, our role is really not just to advocate for the resource mobilization component. Our credibility is also as much as we can raise our voice and utilize our voice and experience to call the global health institutions also to account, whether it's accountability of impact, whether it's accountability around the resources and how it's invested. It's very important, especially for us from implementing countries. It's actually very difficult to only do the resource mobilization part because the money is being spent right here in our countries. And so as civil society, it's really important to twin the agenda where we support resource mobilization, but also really think about the accountability frameworks and how we show the value for the money. And the last thing is the whole issue around domestic resource mobilization. We see that it's a very important component where you twin international collaboration or resource mobilization, replenishments for the global health institutions, and a narrative around domestic resource mobilization. It's important. The conversation around sustainability has become more and more meaningful in the replenishments. There is a desire to see like how long and what are the efforts around sustainability, which is very important. I think, Jenny, because you did mention the challenge around the debt issue, which is then also connected with the DRM component, it's going to be very important to also, especially for implementing countries, to engage the people, And I think that's something as civil society we can do. What is happening in Kenya right now, which is, I can talk about it because I'm in Kenya. I was in the streets yesterday, and it's really something to think about even as we go into the replenishment, because much as in we are talking about like international agencies, what is happening here is a mistrust, one of the many elements. There are so many things happening in this conversation. And this conversation is not just about the finance bill. It is also about issues of governance. It's issues around accountability, issues around transparency. And at the center of this conversation is the IMF and the World Bank and their fiscal policies and their finance policies. And so just thinking about that, even as we think about to what extent can you mobilize voices, local voices, communities to support international financing, especially through multilateral agencies, in a way that people can actually trust international funding. I see it as an emerging phenomenon right now. So I hand it over back to the moderator and very happy to take questions. Thanks.
Thank you so much, Rosemary, for that perspective. And with that, I want to leave as much time as possible for questions. Just as a reminder, you can use the raise your hand function or drop your question in the chat. I know a few of you have already started doing that and have gotten some answers from Ginny and Jean already. But with that, let's open the floor for questions.
There was one question in the chat from Fiona I could address off the bat, if that's helpful.
Thank you.
Fiona asked, she raised what often comes up when we talk about the complementary nature of some of these institutions. So Gavi and Global Fund, this comes up the most, I think. If they're so complementary, why don't we kind of combine them so that we can combine and avoid financing like overhead structures, boards of two different institutions? Would that be more efficient? I think this is, I don't shy away from this question. It's a rational question. And ultimately, I do think we should be, as we look forward, thinking about where the synergies are, especially at the top, to find more efficiencies. There has been a number of efforts in the last couple of years to do that. This is one of donors' favorite questions to ask us of how are they kind of streamlining efforts, particularly at the secretariats. So it's not something I think we should dismiss, but I do think that the practicalities of just straight up merging these institutions is quite challenging and should not be looked at as a quick or even a sensible fix to finding efficiencies. There's a handful of reasons. First, they have different mandates and different focus areas. And that cannot be dismissed. They are very different and they have completely different operating models and governance structures as well. So merging the structures and the mandates would require significant organization and alignment on policies and procedures that honestly might not make sense, even at the secretariat level, and could be very disruptive for programs on the ground, which is something we don't want to see. Their funding mechanisms and how they allocate are also quite different, and it would be complex and potentially disruptive again to kind of change the way funding flows and who they flow through. The Gavi funds kind of works directly with the governments, with some stakeholder buy-in. Gavi does that. Global Fund has country coordinating mechanisms in a completely different way to allocate funding. So harmonizing those would be really difficult and potentially disruptive. There's other issues with brand identity and trust, operational and kind of administrative costs. I could write up a laundry list, but it's not, I resist the kind of, let's just merge them. There's so many elements that I think would be very disruptive of the programs. And at the end of the day, we don't want to disrupt the way money flows and how it's impacting programs. Where I do think we can continue and should continue to push these institutions is finding those synergies on the ground. They are doing quite a bit to coordinate their investments at the secretariat level. And I think the closer we can get the planning with the government, the closer we can get together with the government. And we've heard this from governments too. They're dealing with Global Fund, Gavi, I'm blanking. IDA, there's so many others. The more we can link up those planning processes on the ground without disrupting kind of some of the good pieces that are in place, particularly with country coordinating mechanisms from Global Fund and bringing in civil society, we need to just be really careful we're not kind of breaking down those structures that have been wildly successful and part of the reason these institutions have been a success.
Janine or Rosemary, did you want to jump in on that question before we move on to the next one?
Maybe I'll come in with just a little sort of follow on from Jenny's point, which is just to say that I agree. I think, I think this has been a perennial sort of point we continue to come back to. It's a really, really important one. It's one we continue to come back to. It is really complex, as Jenny said. I think one of the things that I hope to see is that, we're not going to see this change happen in the next 2 years, but as part of these, these inflection points where these institutions sort of lay out their strategies for the next 5-6 years, I would like to see them start to articulate more of an ambitious vision for how they're going to work towards greater harmonization in the future. As Jenny said, it's not going to happen overnight, but they have to start, and I think should start, to do so in incremental ways. And I think for Gavi and the Global Fund, we are already seeing, I think, some openings to do that. The malaria vaccine, I think, is an area that's already sort of forcing these two institutions to coordinate. I hope we'll have a next generation TB vaccine soon. And, thinking about different sort of policies and approaches, Jenny mentioned some of the differences between Gavi and the Global Fund, but, even thinking about their eligibility policies, for example, I think some of the highest burden TB countries are not eligible. Indonesia, the Philippines, they're not eligible for Gavi support. If I remember correctly, they are eligible for the Global Fund. How are we going to work out some of these kinks going forward? And I think in anticipation of these new technologies coming down the pike, there should be, again, sort of in advance, laying the groundwork for incremental change and greater coherence and harmonization. So just wanted to kind of piggyback on Jenny's point, but I'll pass over to Ansley.
Rosemary, did you want to come in on that question before we move on?
Yeah, I wanted to quite agree. And I think for me, it's finding the synergies across the mandates of the global health institutions and across the lines of funding. I think it's the conversation around the consolidation or bringing them together is I think it can be quite complex because of the way they are set up and the mandates that they are given. But I think the synergies is very important. And the other thing is that I think going back to the fact that global health is already deprioritized, within the context of development, how is bringing them together helpful, and what will we be foregoing? I think that's an important question. And the last thing is, I think the other thing we can do is to strengthen synergies at the country level when it comes to the implementation. I think that's important. So that's pretty much agreeing with Jenny and Janine. Thank you.
Thank you all so much. And with that, I will move on to Philip to ask his question.
Hi, thank you so much. This is a really, really helpful discussion. I'm Philip Pino. I'm the Senior Multilateral Officer for the Global Health Technologies Coalition. And my question actually piggybacks a little bit of what you were just talking about, thinking about harmonization, but then thinking about it from an advocacy perspective. And so, obviously we should continue to push Global Fund and all these other actors to harmonize with Gavi and others to sort of bring them together. But then thinking about it from our perspective here on the call, we have a lot of advocates who are going to be pushing for all these different replenishments. And so what can we do to sort of help coordinate amongst ourselves, essentially, and ensure against the backdrop of all these different political challenges that we're going to be facing in the fall, that we're going to be putting our best foot forward. And I say that in particular because there are some sort of new replenishments, right? I think this is the first replenishment for the pandemic fund. The WHO investment round is a sort of new process. And so I'm curious what your thoughts are on that, as how we can best sort of arm ourselves essentially with the right tools to ensure that we have very successful investment rounds and replenishments in the fall, and that we'll continue to push for all these different fundings to go to global health. So thank you.
Thanks so much, Philip. And Jeannie, Jenny, and Rosemary, just feel free to jump in on that. I think any and all of you could answer that question really well.
Your question was mostly on like coordinating ourselves as an advocacy community, right?
That's right. Yeah.
Yeah. I mean, I don't have a quick, like, I don't have a great answer. I actually am looking at Rosemary because you're doing a lot of this. There are fora for each of these institutions that are coordinating for like Global Fund, Gavi. There's IDA. There's like good community organization there. I do think we could do a better job linking between them. I think one of the challenges is that some of these aren't like, well, there's also been a really good effort, I'd say, between Gavi and Global Fund in particular, and actually not so good on the IDA side. So we can come back to that. But Gavi and Global Fund are being very, very intentional with doing their planning together, having joint messaging, understanding where they want to talk about things together, where they don't, how they differentiate each other. I've never seen this level of coordination at the institution level, and that is trickling down to civil society. So I think the more we can ask for that kind of coordination at the secretariat level, I do think there's probably more we can do kind of between like GFAN, which is the major kind of major organizer for a Global Fund, and then and others kind of organizing around Gavi. I know the Pandemic Action Network in the past has been a useful coordinating piece, but it's not working on this as much. But I do think we should find those touch points when we're all in a room of people working on different replenishments to continue to raise these. One of the challenges though is like Global Fund hasn't really started yet. So like we're not even sure how to coordinate there yet. We're just like thinking about it a lot. So I think that there's a little bit of it's something we should all be mindful of and reactive to in real time continuously for the next 12 months and not settle into one silo. The one thing I wanted to flag on IDA is I have seen some kind of reductive things coming from the IDA side. It's not on civil society. No one's being intentional about it, but some of the statements coming from leadership at IDA are kind of like, you know, they're not super supportive of the of Global Fund and Gavi in particular, but kind of the health verticals, if you will. And I do think we can and should push back on that. One is advocating for IDA. I think IDA and more concessional financing is wildly needed, particularly with the debt crises we're seeing. We need to open up a lot more space for countries there. But we need to make sure that pushing for IDA funding is not coming at the expense or belittling the role that health verticals have to play. So I think that's something when we see it, we need to call it out, and we need to have messaging at hand to hold our leaders accountable to not undermine each other.
Yeah, I was gonna, agree with that and say it's going to be very dangerous for us if we pit one against the other. And right now, I think what we need and how we can unite our voices is to really call for greater recognition and investment in global health. Like if we can get global health to be prioritized, to be a priority within the development agenda, within the, even ODA budgets and so on and so forth. I think that is going to be, I think that's the place where we can unite. The UN Summit of the Future has shown us that we are totally deprioritized. We have had to fight even to get the health, impact coalition going. And so how can we all come together and say, it's not money for Gavi, it's not money for the Global Fund, it's not, and all those are channels and they are mechanisms, but how can we really rally our voices and say, we need the world to do better for global health? So I think that can be a rallying note, like for increased ambition around global health.
Thank you. Well, just in the interest of time, we'll go to Peter.
Yes, thank you very much, and thank you for giving an overview of the health landscape. And I really do like what Rosemary said about the mandate, making it a mandate for global health institutions and governments to put health at the forefront and make it a global, public investment. My worry is that we are also struggling with the issue of the touchline, the SDGs, where the countries were supposed to be racing towards self-financing, domestic resource mobilization, and we are talking about localization. Considering that we have even struggling with reaching the Abuja, how can we twist our language to say now that the SDG goals are there, but we are far from it, and therefore we need another mechanism to proceed on, and therefore we need the investment in health more to continue as part of the mandate. Thank you.
Jenny, Rosemary, you don't want to comment on that one? I think it's definitely something to consider. Thank you, Peter. David.
Yeah, just real quickly on the issue that Simon was raising in the chat, which I think is really important, and others have touched on it too, in terms of what Kenya has been going through and provoking some of the protests that we've been seeing. The roots of that, part of it, lie in the international debt crisis. I'm wondering if speakers could address how some of the organizations on the call today could contribute to efforts for cancellation or debt relief. Another way to raise more money for financing. A lot of us are funded to raise money for specific health topics. I think we have to think beyond our comfort zone and what we're specifically mandated to work on in order to actually make sure there's more money available and that debts are relieved.
Thanks, David. I wanted to bring this up as well. I mean, I think what's happening in Kenya is really humanizing the debt crisis in the worst possible way, unfortunately. But it cannot be separated from the broader conversation on replenishments and health financing. It reinforces the need for grant financing in this moment in particular, with rising interest rates, rising debt. And it reinforces the need for reforms in the MDBs and for a lot more concessional financing. That is not the whole answer. I agree, there needs to be debt cancellation and other efforts along those lines. But when we're talking about mobilizing resources for health, those have to be part of the solution and increase dramatically. And I think that, you know, I'm watching what's happening in Kenya just like this. I mean, it's terrible, and it is the human face of something we've seen coming down the pipe for a long time. So I don't want to instrumentalize it by any means, but I do think we should be reminding people these aren't isolated issues that are happening in a vacuum in conversations around economics. These are having a real impact on policies and on people. And we're going to see more of this, I think, if there's not a handle on it. I wanted to point you towards what one is doing, just if people are curious about that. We have been working on the IDA elements of this for a while, and we have a whole other program of work on it. I'm putting what's called a data dive. It's just a pretty simple analysis, but on the hidden impacts of rising interest. You can look at any country. You can do a deep dive on the data of any country. You can look at Kenya specifically, who's holding the debt, how much is it, and kind of really start digging into what some of the solutions might be, who needs to forgive debt, where we need to be looking at those kind of efforts. So there's a bit of a roadmap here. You could look at it country by country on how to kind of manage that and what we should be advocating for outside of the IDA reforms and the health financing pieces that we already are doing.
Yeah, maybe just to quickly come in and echo one of Dave's, to really underscore one of David's points, which is I think, you know, we really need to sort of think about the hugely consequential role that the macro fiscal context is having on financing in the social sectors. And I think that if we are not mindful of that, that could be really detrimental to, you know, I think a lot of the sort of could have serious impacts on, you know, people's lives, as Jenny said. So I think we just really sort of thinking big picture, thinking about the political dynamics and the macro fiscal context that we're operating in. It is really, really complex. You know, I think we need to step out of the fact that, okay, we need to raise $100 million for nutrition and $100 million for malaria. Of course we do. Those are so important. But I think without taking this big picture view, it's going to be really, really hard to keep sight of all of that. So I just really wanted to mention that, and really sort of, if that's one point everyone takes away from this discussion, I think that will be really important.
Yeah, and I completely agree with the speakers, and I think what's happening in Kenya today is a buildup of policy decisions that have happened over the last couple of years. And it's very complex. The ripple effect is huge. And I think one of the things we are seeing as we go, even as health advocates, is how we can strengthen our partnerships and relationships with colleagues who work in like the tax justice, in debt issues, and really expanding that network, broadening our understanding of the fiscal space, the macroeconomics, and so on and so forth, so we can, you know, contribute to the solutions. I think with debt cancellation, very happy, Jenny, to hear that one is doing something around that and can maybe reach out around that. One of the biggest challenges is when you have debt cancellation. We saw this during COVID, where the amount that you save from the debt cancellation is then the question of how it's governed. So at the end of the day, it doesn't help anyone, and it takes you back to the cycle. So there's a lot also around transparency, accountability, and so on and so forth. Really agreeing it's a complex issue.
Thank you so much, Rosemary, for closing us out there. And thank you to our other speakers, Jenny and Janine, for sharing their perspectives and their expertise. I think it's been an incredibly wonderful discussion, a productive discussion with many questions and communication back and forth. We know it's a challenging time fiscally and politically with global health budgets, but I think our speakers have reminded us just how important these multilateral organizations are and their incredible impact, the synergies that exist between them, and how we as civil society must not lower our ambition when we are advocating for these replenishments. I just wanted to say thank you again for joining. If you have questions, please feel free to reach out to advocacy@globalhealth.org or check out our website, globalhealth.org. Thank you again for joining. A reminder that a recording of this meeting will be shared with participants and posted to our YouTube channel as well. And we look forward to many future conversations. So thank you again to our speakers, and have a great rest of your day. Thank you.
Ali sangu tu